Hi, everyone, and thank you for joining us today to learn about the One Valley Healthcare Program. My name is Anna Robinson, and I am the Program Manager for the Vail Valley Partnership. I will be your main point of contact for any questions about this exciting new program. I may not be able to answer all of your questions right away, but we have partnered with the Small Association Leadership Alliance to make this program a reality, and they're a wealth of knowledge and answers. We are very excited to be able to offer the One Valley Healthcare Program as a viable option for lowering healthcare costs in Eagle County. It is an alternative approach to solving a real problem in our community, and we're glad you're here today to learn more about it. I encourage you to watch this webinar and then explore the documents on our website, onevalleyhealthcareprogram.com. You will also see my contact info at the end of the webinar, so please don't hesitate to use it. Without further ado, I'll turn it over to Kevin Kennedy and Rich Lawson with the Small Association Leadership Alliance.
All right, thank you very much, Anna, and welcome everyone. As you can see here, we're going to talk today about the One Valley Healthcare Program that is affordable, accessible, and effective. So in designing this program, we had a couple of priorities. One, it must be a national program available to all of our members in all 50 states, although most of our members are, of course, based in Eagle County. We do have members outside Colorado, and of course, we all like to travel. It also must reduce costs in a meaningful way. We'll talk much about the cost savings as we move forward. So the program we're going to talk today is really a solution to the high cost of healthcare. We have simplified what has become so complex by offering a high-end affordable healthcare solution and a choice of affordable healthcare options. As some of you may or may not know, the healthcare provided by companies has shrunk in recent years, and in fact, less than half of the U.S. small businesses actually offer healthcare. So this program allows anyone to join who is a member of the Vail Valley Partnership, individuals, businesses alike. And it lowers healthcare costs by as much as 60%. So it's a truly great way to save costs on the ever-increasing and unsustainable healthcare costs that we've all incurred. So we're going to talk today specifically as an alternative approach to traditional health insurance. We have partnered with two great groups, Apex Management Group and Sedera Health Plan. Apex Management Group offers two different plans to choose from, an Advantage plan and a high deductible plan. I'll talk about both of these in some detail, but these are really for the small to medium costs that we all incur in preventative care for our physicals and related. Sedera Health is another partner of ours, and they offer coverage for significant or catastrophic type events. So when folks sign on, you're going to choose one plan from Apex Management and a second plan from Sedera Health, because together, these provide comprehensive, cost-effective coverage for all of us and an alternative to traditional health plans. Let's talk about some of the details. We'll start first with Sedera. For those of you who are not familiar with medical cost sharing, it goes back to the 1980s. And it was originally formed and is still maintained today by religious groups. So folks from different churches or congregations would get together and form an organization where they would share each other's healthcare costs. Sedera is not a religious group, but it is a cost-sharing group. In fact, it's the largest cost-sharing organization in Colorado. Their objectives are simply all of our objectives. It's compliance and credibility. It's lowering monthly expenses and reducing out-of-pocket costs. So let's talk about cost sharing in some detail here. It offers big savings over health insurance. It's healthcare through community versus healthcare through insurance. We'll talk about that in some detail. Industry-wide, as of the end of 2017, there were more than 1 million members in the cost-sharing program and more than $1 billion of healthcare costs being shared annually. That number has increased dramatically in 2018. It offers freedom from networks. So what does that mean? It means that if you or your family members become sick with a significant or catastrophic event, you can go to any doctor or hospital that you want. You do not have to operate within the network when operating on your Sedera plan. So it's freedom from networks. Your sharing begins at your initial insurable amount on a per-need basis. We'll talk about that in some detail, but that is the amount you're responsible for out of pocket. And of course, Sedera promotes a healthy lifestyle, something we're all looking to live with. Here's a quick graph on the medical cost sharing, and you can see there in 2013 where participation really started to grow in terms of dollars shared and also the number of participants. And that's when the healthcare costs really started to increase for all of us in a way that's just simply not sustainable or affordable. Now this program that we're talking about today has three components. There are the large costs or needs, and this is the Sedera portion. That's surgery due to an accident, hospitalization to an illness, diagnostic imaging, significant large costs. Then there are small to medium costs. That's the run-of-the-mill type stuff that we all have throughout the year, the cold, sinus infection, flu, etc. Then there's preventative care. Those are annual physicals, childhood immunizations, colonoscopies, and mammograms. So we're going to start here by talking about the large costs. And this is where Sedera comes in. And Sedera talks about these large costs in terms of a need. So what is a need? A need is one or more medical expense caused by a single accident or illness. So as you can see on the graph here on the left, someone broke their leg. There's a ride in the ambulance. There's a stay at the hospital. There's some imaging, diagnostic, and whatnot. There are crutches and pain medicine and physical therapy. So all of those costs are wrapped into one need. So whether it's one bill or whether it's 12 bills, and whether it's cured in 1 month or whether it takes 2 years, that need is all encompassed into one cost for you. Now, your responsibility for that need is your initial insurable amount. That's what you pay before the sharing begins on the need. So on the diagram on the left there, if there were 10 bills and the total was $10,000, but you had an IUA of $500, you're responsible to pay $500. So it's a lot like a deductible that we've all been used to, but it's on a per need basis, not a calendar year basis. So like I said before, if it takes 2 years to cure you, then that's okay. You're still only responsible for that initial IUA. As you can see on the middle there, the IUA is broken down into $500, $1,000, $1,500, $2,500, or $5,000. And then if you're an individual, you're responsible for the first 3 in any calendar year, or if you're a family, the first 5. Now the reality is the majority of us have far less than 3, or families far less than 5 in any calendar year. But if you had a 4th or a 6th as a family, you would not be responsible for any of it. Your IUA would be waived. You would not have to pay it. I look at this as my max out of pocket. So if I have an IUA of $500 and I'm single, that means my max out of pocket is $1,500. So it's 3 times 500. So I look at this just in terms of what my maximum outlay financially would be for my health care. So the Sedera not only will save us costs, save on our monthly expenses by a lower premium, but it also lowers our max out of pocket. Let's talk about medical cost sharing in real life. Here's a pretty typical example a lot of kids go through. This is a young child that had a persistent ear infection. Went through a series of antibiotics, booster injections, finally a visit with the ENT who inserted tubes into the child's ears. On the left is the traditional financial framework for this scenario with health insurance we've all seen. We have copays and prescriptions, and then finally the cost for the surgery at the facility and the anesthesiologist and everything else. So the out-of-pocket for the family would have been right around $2,500. This family, had they been on the Sedera plan with a $500 IUA, their out-of-pocket would have been $500. This is obviously a very simple explanation and description on how it works. But if you had obviously a much larger, say a cancer diagnosis or something more significant in your life, it works the very same way. Let's talk about a few items that are particular to Sedera. That's membership, medications, and pre-existing conditions. First, medications. So in the scenario I gave before where someone had broken their leg, they would have been given, say, pain medicine and perhaps some other drugs. Those drugs are curative. There's an end date to when we stop taking those drugs. Right? We take those drugs to cure us. Once we're cured, we no longer take those drugs. So the cost of those medications, however many they may be, and whatever the cost, are all wrapped up in that need and all part of that need that is shared with the community. So those medications are shared as they relate to that need. Maintenance type medicines are medicines that many of us take, blood pressure, cholesterol. I take medicine for rheumatoid arthritis. Those medications are covered in a number of ways. First, there's GoodRx, which is an option that many people choose, that many of you have probably seen commercials for, that offers great discounts on different prescriptions. For folks taking a significant number of maintenance-type medicines, they may want to look into Liberty Benefits. Liberty Benefits is an add-on that you can opt in, and they offer significant savings on medications, and for an additional cost of $27.50 per month. For most of us, however, you'll see on the second bullet there, the Apex plan has coverage for prescriptions. So for myself, with my rheumatoid arthritis, the Apex plan, which is the second component of this plan that we're discussing today, that offers prescription coverage. So keep that in mind as I go through the the presentation here, that the Apex plan is most likely your best option for your medication for maintenance type medicines. Now, there are a few things that Sedera members believe in. Obviously, we all believe in making smart choices. Diet, exercise, lifestyle can greatly improve our life. Sedera members do commit to strive and live a healthy, balanced lifestyle. Now, that's not legally binding. That's just something that we all commit to try to do. And the goal there, obviously, is to keep the expenses down for the community. Because remember, all of our expenses are shared. And obviously, the lower the community costs, the lower our monthly costs are as well. Members do commit not to use illegal drugs and not to operate a vehicle while intoxicated. So what does that mean in practical terms? It means that if you're driving while drunk and you get into an accident and you require medical attention, those costs cannot be shared because you broke the law. So there's a sense of personal responsibility here that's involved in to all live a healthy and balanced lifestyle, and that includes obviously not driving a vehicle while intoxicated. There's also a surcharge for tobacco users. So if you are a tobacco user, there's a $75 surcharge per month that you will have to pay. Also, the fine print at the bottom there for tobacco users age 50 and older, there's a $25,000 per need sharing limit for the top 4 diseases associated with tobacco, which is heart disease, stroke, COPD, and cancer. So if you are still a smoker, tobacco smoker, now is a great time to quit. Pre-existing conditions. There are some sharing restrictions with pre-existing conditions, so let's talk about these a little bit. So the top 4 there, high blood pressure, high cholesterol, sleep apnea, non-insulin dependent diabetes are all obviously very common. They're all also very well controlled most of the time with medications. So if you have any of these conditions and they're well controlled with medications, it's not a problem. There's nothing to worry about. There are no sharing restrictions. If you have other pre-existing conditions, there are sharing restrictions. So year 1, you cannot share any expenses or related to a need for that condition. Year 2, up to $15,000. Year 3, up to $30,000. After that, it's fully shareable. Now, let's talk about that with a couple of real-life examples. I'm a member of Sedera. I joined in October, just recently, and I have rheumatoid arthritis. Now, my rheumatoid arthritis is such that it's well controlled with medications. I have to get some lab work done every year and see my rheumatologist. But there's nothing on the horizon that would cause me a financial burden. I don't have any surgery or any sort of immediate needs or anything even in the future that would create a financial burden for me. So my pre-existing condition was not a big deal. Another common one is hyperthyroid disease. Many people have that, and it's well controlled with medication. Now, a couple of scenarios that may give you pause from joining this would be if you were pregnant right now. That's obviously a very significant pre-existing condition that would cause a financial burden for you in year 1 because that would not be shareable. Or if you had an active cancer, you would not want to switch to the plan at this time. So all are obviously welcome to join. No one is turned away, but those of us with pre-existing conditions, we do just need to be aware and make sure that we're not creating a potential financial burden for ourselves in joining. And I should say this, that this plan in general is really designed for about 80% of the Americans out there. There are, like I said, 20% or so out there where they have conditions that would give them pause from joining. So those are the large costs, those are the needs. That's how those are handled if, for example, we had a broken leg or a heart attack or a cancer diagnosis. That's how the costs are shared. Let's talk about the small to medium costs. These are the run-of-the-mill, cold, sinus infection, flu, the kinds of things we all run into during the year. These are handled in several ways. The top check mark there is the one I'm most excited about, and that's telemedicine. We've partnered with a group called Teladoc, and they're the largest provider of telemedicine in the U.S. For those of you not familiar with telemedicine, it's really been adopted at a much higher rate in recent years. And I'll give you an example of that. In 2015, only 23% of Fortune 500 companies offered telemedicine, where in 2017, that number was up close to 75%. And telemedicine is exactly what it sounds like. You connect with a doctor virtually, over the phone or through your computer. You tell him or her what your symptoms are, what's going on. If necessary, they can send a script to your local pharmacy. So if you had the flu or an earache, or say you just needed a Z-Pack, they can send that prescription to your local pharmacy. So I like it because it fits my lifestyle, because it means I don't have to go down to urgent care, or I don't have to call my primary physician to make an appointment to get checked out. Sedera also includes Second MD, which is exactly what it sounds like. It's a second opinion from some of the nation's top doctors. The doctors are at places like the Mayo Clinic and Johns Hopkins. So there are a number of great ways that Sedera can help us with the small to medium costs. The Second MD, I should mention, is also required if you're having an elective surgery, which also makes a lot of sense. Just get a second opinion before you go in. And that's all done virtually as well. You can see some other services provided there by Sedera. But now I want to switch gears. Because when we started the presentation, remember I talked about when folks sign up, they choose first the Apex plan that they want to participate with, and then they choose the Sedera. So we've gone through the Sedera. Now let's talk about Apex, because the Apex plans also offer coverage for small to medium costs, such as cold, sinus infection, and flu, but also preventative care. So this is how we get a comprehensive plan. So with Apex, there are two options: a high deductible health plan. That's the first option here, and that offers 100% coverage for preventative care. As you can see listed there, 21 for adults, 28 for women, 31 for children. There's a total of 80 or so preventative care services included here, including physicals, well checks, colonoscopies, mammograms, childhood immunizations, etc. So this first plan, really, the goal of the plan is to provide a framework for the health savings account. And this is a great option for younger folks that are out there and that are quite simply healthier than those of us who are a bit older. A health savings account allows you to put away tax-free dollars to pay for your medical needs. So the funds can be used for dental, vision, prescription, doctor visits. It can be used to pay your IUA, your initial insurable amount with Sedera, and it can all be done with tax-free dollars. You can see some limits there of $34.50 and $6,900. Those were for 2018. They are increasing a little bit in 2019, and that's how much money you can actually put away on a tax-free basis. So if you are healthy, if you really only go to a doctor for preventative type needs, this would be a great plan for you. And keeping in mind that you have coverage for significant and catastrophic events, and you have coverage for preventative care, and if you are healthy, this is a really good option. The second option is the Advantage plan. And this is actually the option I went with, and I'll explain why. Like the high deductible plan, this offers 100% coverage for all the preventative care, physicals, colonoscopies, mammograms, immunizations, etc. But it has a co-payment structure for primary care, specialists, urgent care labs, and it also has prescription drugs. So as you can see on this slide, the copay scenarios are very similar to what we all have now. So if I go see my primary care, it's $20. Now keep in mind, when I see my primary care physician for physical, that's covered 100%. So this would just be if I saw her for other needs that I did not also use the teledoc for the telemedicine. So chances are I'm not going to be seeing her as often as I used to. But when I do, it's $20. It's also then $50 when I see a specialist, and that would be my rheumatologist. It would be $50 if I go to urgent care as well. I am hoping that my visits to the actual doctors go down with telemedicine, except for my specialists that I do have to see. This is the reason I joined, because I do take medicine for my rheumatoid arthritis, just like many people do for cholesterol and high blood pressure and similar. And I wanted the prescription coverage at a low cost. So it has tier 1 and 2 generic costs, very similar to what many of you have now or I've read about. Then tier 3 for preferred name. Tiers 4, 5, and 6 are really for higher level drugs that are most likely related to a need and would be covered by your Sedera plan. So this is the big reason why those of us who take maintenance type medicines choose the Advantage plan as opposed to the high deductible plan. Now, when we talked about Sedera, if you recall, I said that Sedera does not operate within a network. You can go anywhere you'd like, any doctor or hospital or clinic that you would like to go to, you can go to under Sedera and share those costs. Now, for your primary care type visits, for any specialist visits, again, I'll use my rheumatologist as an example, where you use your Apex coverage, you have to work within their provider network, and that is under MultiPlan. Now, MultiPlan is actually one of the largest networks in the U.S. There are nearly 1 million doctors on the network, so the network is very large. And that's the network you need to operate within there. And on this site here, you can simply see how to check what doctors are close to or within your zip code. And all of this is on the website as well, so there's no need to memorize it. So let's talk money. How much does this cost? What is the true savings? So when you sign up, you will first choose your high deductible, either your high deductible plan or your advanced plan. And these are the two options with Apex that we discussed. And you can see the pricing there on the left. member only, member and spouse, member and children, or member and your entire family. And on the left is the high deductible plan. And again, remember that does not have copays or that does not have prescription coverage. But if you're younger and healthy, it's a great way to get the preventative type care, get your annual physicals, and put away some tax-free dollars for significant events. On the right is the Advantage plan, which has the copay structure and also has a prescription coverage. And you can see the arrow I pointed there is the 144.59, and that's what I actually enrolled in. And you can see the different levels there for the member and spouse, member and children, member and family as well. So you choose that, and then you choose your Sedera plan. And now, as I said, Sedera offers multiple options with this program. You can have $500, $1,000, $1,500, $2,500, or $5,000 IUA. And the cost per month goes down as the IUA increases. The one I chose here is a $1,500 IUA, and I chose that just because it's middle of the road, and that puts my max out of pocket at $4,500 should I have 3 events in any given year. So it just financially made a lot of sense for me to choose this one. On the left there you can see it's member and only, member and spouse, member and children, or member and family. And going across the top you can see it's segmented by age. So those in their 20s or 30s, I'm in my 40s, or those in their 50s and then 60s. So for this plan, I chose the one for member only, 40 to 49 for $175.51. So my total cost is $320.10, and that's what I pay every month. And that gives me 100% coverage on my preventative care. It gives me prescription coverage for the maintenance medicine I take. It gives me the copay structure because I do see a specialist a couple times a year. And then it gives me catastrophic and significant coverage for events that may occur where my max out of pocket on each need is $1,500. So it has dramatically lowered my max out of pocket every year and has significantly lowered my monthly cost. So that is the plan cost. Now, on the OneValleyHealthcareProgram.com website, you can find all of this information. You can find the current rate sheets, including the cost breakdowns for all of the Sedera plans. You can find detail on the Sedera plan overview and the sharing guide, details on the Apex and Advantage plans. There's a great frequently asked question on the telemedicine. As you can tell, I'm very excited about that one. There's also the second MD information overview and the multi-plan search. Also on that website is the enrollment link if you would wish to enroll into the One Valley Healthcare program. So here's a summary of the offering. As we discussed, it's available in all 50 states, so you can travel as needed. Even if you travel overseas, those costs can be shared, the significant costs, the Sedera costs, should you get injured or have a medical need. It does not need an employer sponsor, so individuals can join. So if for example, you run a restaurant and you are not able to offer your employees health insurance, but you're a member of the Vail Valley Partnership, your employees can sign up and join and participate in this plan and get the coverage they need. It's available to full-time, part-time, and seasonal workers. It's available for hourly and salaried staff, and as I said, the cost can be paid either by the individual, the employee, or by the employer. And it's a terrific benefit for folks to offer their employees. The potential savings of 60%, that's really the average. It really varies even where you live within Colorado. The cost can vary dramatically, but 60% savings is the average, and that's only monthly costs. As I said, the max out-of-pocket costs are actually much greater. But that's the offering summary. Here you can see the contact information for Anna. Again, the website for the OneValleyHealthcareProgram.com and the email address to you should you have questions. So with that, Anna, I'm going to turn it back over to you.
Thanks, Kevin. That's a lot of good information. So thank you again for joining us today. We hope you're as excited about the program as we are. And please take some time to explore OneValleyHealthcareProgram.com. It has a lot of in-depth information about Sedera and Apex, as well as plan details, rate sheets, provider search, FAQ, and a lot more. And of course, please don't hesitate to reach out to our team at the Vail Valley Partnership. We are here to help you.